Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwanitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on, let's get between the sheets. Welcome back to Between the Sheets. We have another exciting episode for you today. We're going to get into some pre and postpartum conversations, and I have an amazing guest on here with us today. This is Anna Downs. She is a personal trainer that specializes in pre and postpartum exercise and movement and activities for our ladies. She's coming all the way to us from Bangkok today, so we're going to welcome her and have a great show. Thank you for coming.
Thanks so much for having me. I love talking about this, so yeah, let's go.
Good. Yes, absolutely. And it's so important. And, there's so much of the pre and postpartum time frame that, we on this podcast, we focus a lot on sexual health and all of those changes that we go through, the hormone, the physical changes, all of these things, the mental changes of becoming a parent and things. I mean, you're just jumping through hoops. So I'm very excited to have this conversation with you and see how we can get some more information out here to our moms and our almost moms and the dads who need to support them, or however people are in families.
Absolutely.
Yeah. So when women come to you, what are their biggest things that they're coming to you for? Do they want to just stay healthy while they're, pregnant and stuff? Do they want to have specific needs like pain or something like that? What are you helping with?
Well, the entry point is usually they want to be fit and strong through their pregnancy, but they don't know how, and there's so much fear around how to move safely. Well, because there's so much contradictory advice out there. And so they're wanting a clear path that they can follow to build their confidence. But what we find along the way is that fear is just the scratch of the surface, and it's not. They haven't really, yes, they do want to be strong and fit during their pregnancy, but then they just need someone and somewhere that they can trust, that they can ask all their crazy questions to and kind of feel safe that they're being guided in the right direction. Because every time they dive into Google, it's a terrifying place that always makes them feel less confident. And so,
absolutely. Yeah. Lots of conflicting stuff out there on Google.
Yeah. Dr. Google is dangerous.
Very dangerous. Yes. And, I Google stuff too, but I'm pretty well versed in what sites to look for and when to filter out the BS.
Yes, absolutely. Absolutely.
Yeah.
And then postpartum, if someone's meeting me for the first time, again, they are in conflict with their new body and how it responds, because they've got to know their body really well for the past 20, 30, 40 years. And then suddenly it's feeling different, it's responding differently. And again, they're just seeking that guidance so that they can navigate through this next phase confidently and feeling empowered.
Yeah, absolutely. I remember after both of my kids getting back to basically the same weight that I was before I had them, but nothing fit the same. My feet weren't the same size. My jeans didn't fit the right way anymore because so much changes in your body, both carrying the baby during pregnancy and then also, during delivery as well.
Yeah. And also your postural changes carrying the baby postpartum. There's no other circumstance in your life where you'd go through something like birth, whether it's C-section or a vaginal delivery, and then within hours someone's handing you what is a dumbbell, a kettlebell, and then they're saying, right, this is going to get progressively heavier for the next 5 years and beyond, but I want you to hold it all the time, just
all the time,
like if you're in the gym. No, that's never happened in any other life scenario, and we don't train for that. And it's unsurprising that you get so much pain and tension, and with holding something in the front of the body, that changes your rib cage compression, which then changes your pelvic floor length and compression, which then has an impact on your sexual health. And, everything's connected. And I think we need to stop looking at things in isolation and be able to look at our body and how our movement patterns are changing, and because it has an enormous effect on parts of our body that you wouldn't have thought.
Yeah, absolutely.
a constant conversation I'm having with my ladies.
I bet. I bet. I know my sister, when she was pregnant, I believe all 3 of her pregnancies, she really struggled with pain in her hips. I believe there was like a ligament in that area, maybe the round ligament or something that was really bothering her. Is that something that you see frequently?
Yes, I mean there are two kind of extreme common postures that are really common postpartum. One is to have a forward tilted pelvis, so you get that really exaggerated curve in the lumbar spine, and that
Mhm.
usually comes with a flare in the front of your ribs, like you look
Okay.
like a duck,
Yeah.
your
Okay.
butt coming out, and that has usually people have pain in the front of their hips or in their lower back where the spine is
Mm.
compressed. And the
Yeah.
other one is that they're tucking their butt underneath them and they're clenching their butt cheeks the whole time. And that
Mm.
can also have an effect on a different part of the hips. But that
Yeah.
also really affects the pelvic floor because you're carrying a lot of tension. It's always gripped, it's always tight. And we know
Yeah.
that any muscle, in order to be happy and responsive, needs to be able to stretch and compress
Mhm.
and contract easily. And we don't want either to be stretched or to be compressed.
Yeah.
We want to be
Yeah.
stretchy. Yeah. So those are
So for
two. Yeah.
Yeah, absolutely. So for your ladies who are currently pregnant that you're working with, are you doing lifting weights, cardio, stretching? Is it a combination thing? How are they working out?
I mean, we do group settings and we also do one-to-one settings. One-to-one is totally personalized to how people need to move. So some
Hmm.
people, especially if they're suffering with some uh, issues such as a low-lying placenta, we have to be more moderate, more careful with what we're doing. But unless you've been given indication by your healthcare provider that there is a danger to your pregnancy with exercise, my mantra is we do things to the fullest capability that you can. So we lift weights, we do our cardio, but we make sure there's a lot of mobility in there because you get tight in different places as your posture's changing. In order to carry a baby, you have to tilt the pelvis forward, and the pelvic bowl at the top has to widen in order to support the base of the growing baby, that weight of the growing
Yeah.
baby. And that has a big impact around the hips, around your glutes, around your pelvic floor, and massively
Hmm.
in your core. And
Yeah.
so we are, we continue to lift weights because we have to train for the athletic event of birth. However
Yeah.
you deliver, having a C-section is major surgery, and we want to be fit and resilient for that. But having a vaginal delivery is also pretty epic. So we
Yeah.
want to train and have fitness and stamina for that. But we're never just training for D-Day. We're never training for the day
Hmm.
that you meet your little person. We're training for parenthood, which is a lot
Yeah.
physically, emotionally, hormonally. And so the more we can get in the tank, the more we can build up your fitness and stamina in your pregnancy. Um, it is for me anecdotal at the moment because I haven't been doing any scientific data collecting,
Yeah.
but recovery postpartum is so much faster and so much
Yeah.
easier. And the women that I'm working with tend to have less severe postnatal depression and postnatal
Hmm.
anxiety because they're just so much more resilient and fit
Yeah.
and kind of ready.
Yeah, that's such an important thing. With my daughter is my oldest, and I was in nursing school at the time. I was just so, busy, and I really didn't make, staying healthy and moving part of my daily life with that. And it was a really struggle for me postpartum to get back to even just going on walks and things like that. And with my son, but I had C-sections with both of them. With my son, I was working as a nurse during my whole entire pregnancy. So I was on my feet working, moving and doing, and my recovery was so much better with him. Um just physically. The
Right.
mental part was a different story, but the physical part of just constantly moving my body made such a difference for me. So it may be anecdotal, but I fully support the the thought process.
Yeah, I mean, there is some amazing research coming out at the moment. It's just such a tricky area to do research because nobody
Mhm.
wants to take the risk with um, prenatal women. So yeah, but there is great research coming out of a couple of practitioners in Canada and the States at the moment, which is so welcome.
Yeah, absolutely. How about you mentioned about how we're going to carry this baby after we give birth. Do you work on specific exercises while they're pregnant to get ready for the way that we hold kids?
I don't teach people how to specifically hold their children. I mean, that would be outside of my professional remit. But what I am doing is I being able to identify the muscle groups that you'll be using, the
Mhm.
ones that are gonna get super tight, your chest and your shoulders, and,
Yeah.
even if you've got your viewers looking on the camera, if you are tight in the front of your shoulder, in this chest muscle here, it's gonna
Mhm.
pull the shoulder forward. The minute I do that, watch this
Mm.
muscle on my neck. Can you see how it pops up
Oh,
and it's really
yeah.
enhanced? So, if you're
Yep.
always carrying something,
Mhm.
you're going to be tight in the front of the shoulder. So we need to learn techniques to stretch this muscle. And then our
Okay.
opposing muscle, mid back and
Yeah.
upper back, we need to strengthen that because it's going to pull the shoulders back and hold you in a posture where you're not going to get that tension coming up the neck, which is the
Yeah.
most common complaint I get from my mums is like, oh my God, I just want someone to rub me for hours.
Yes.
Yeah.
Yes.
Yeah. So, I
Yeah,
mean,
and especially as your baby starts to gain some weight and then you're lugging the car seat and the baby
oh
and
my
you got all
God.
this extra weight on one side and it's just not good for us.
Yeah, I know, and especially for our C-section mamas,
Mhm.
I mean, if you'd had any other abdominal surgery, you'd go home for 6 to 12 weeks and they'd say,
Yeah.
"Don't lift anything heavier than your handbag." I mean, that was the advice
Yep.
I got after I had abdominal surgery. Yet, already your baby's gonna be like 3, 4 kilos when they're born, and they
Right.
rapidly increase. And, there was no way that anybody having abdominal surgery would be told to carry weight continuously on the front of their body while in a hormonal shitstorm, um,
Yeah.
straight
Yeah,
away. So,
exactly.
yeah, the more we can train for that, then the more
Yeah.
resilient we are.
Okay. I love
Yeah.
that. I love that. And there's a lot of concern with like laying on your back after so many weeks and things like that. Can you kind of talk to us about how we would modify things?
So yes, I mean, the advice when I first started my training 15 years ago was that pregnant women should not lie on their backs.
Mhm.
And if they did lie, they should be on their left hand side.
Mhm.
Um, that is still the case because it's more optimal to lie on your left-hand side, just because of where
Mhm.
your vena cava is, where the blood flow goes. There's much less restrictions if you're lying on the left-hand side of your body. You don't squish it as much,
Okay.
and because by the end of your pregnancy you've got an extra 50% blood volume, there's a bit more work happening in our system
Yeah.
to get everything flowing. Um, but we now know that there's only a small percentage of people who actually have a danger. It's like really dangerous for them to lie on their side, and they will feel really unwell if that's the case.
Mm.
Um, so if your gym program has you doing some hip thrusts or has you doing some glute bridges, if you don't feel unwell and you're just doing it for a few minutes, that's okay. But if you feel lightheaded or you feel like your feet starting to swell or you
Mm.
get a headache straight away, then that's not the position for you. But you will
Okay.
feel unwell. It is, you're like, oh, this isn't feeling good in my body.
Okay.
And there is a million different variations to every movement and exercise. And as long as you know the muscle group you're trying to work, then you can
Mm.
resolve that. So, for example, if you're doing a glute bridge, that's
Mhm.
commonly working your butt and your hamstrings. We can do that in standing by kicking a cable backwards. We can do that with a deadlift.
Mhm.
There are so many variations as long as you know which muscle group you're trying to target.
Yeah. Yeah. Oh, that's so important, I think, because, I mean, I remember being taking a nap or something like that and still trying to remember, and that was so minor, but like in working out, a lot of the times, when
Mm.
I'm not pregnant and I'm working out, there are things that you do laying on your back. And so that was an interesting one for me to talk about because I have always been told that women who after 16 weeks 20 weeks whatever it is in their pregnancy really shouldn't be spending time on their back.
Yeah, I mean, and I have so many mums who wake up in the night and they call me the next day, like, how did I wake up? I was lying on my back. I was asleep on my back. Oh my God, is my baby going to die? I'm like,
Yeah.
very, very, very unlikely.
Right.
But the data is there to show that some people do have a problem, but it's
Yeah.
not and in the absence of information in pregnancy, we're mostly told to abstain,
Yeah.
which you know I think it's unhelpful. I think we need to take a more individualist approach.
Yeah. Yeah, for sure. So when the ladies are, coming back to you postpartum, are they waiting until they've gotten their 6-week okay from their OB? Are they coming in right away to do some gentle stretching? How do you do with things postpartum?
Um, Again, in a group setting, I don't want people to come into a group setting where there's less attention on them individually until after they've had their all clear from their OBGYN. But
Mhm.
with the one-to-one service, there's some really clear evidence that's come out in the past 6 months saying that we know that 100% of pregnancies beyond 35 weeks will develop a diastasis recti, which is the separation of the abdominal muscles. So
Mhm.
they need to stretch and widen in order to accommodate the growing baby. And we
Yeah.
now know that if we can start the rehab process in the first 6 weeks postpartum, there is it
Mhm.
much faster to resolve, and much less complex to resolve. So that newly stretched tissue is much more responsive to change than older stretched tissue. That's not to say that like 5, 10 years down the line you can't still work on it and
Mhm.
you can still resolve it. But that first 6 weeks is now really crucial. Um, but I think it's really important to note that starting back with your exercise postpartum isn't skipping back into what you were doing in your pregnancy. Even in the last few weeks of your pregnancy, it
Mhm.
has to be taken down 10 million notches. So, for example, in that last week of your pregnancy, if you were working out right up until you delivered, you could be doing a pretty hefty but
Mhm.
modified workout where your heart rate's getting really high, where you're working till you feel the burn. um,
Mhm.
Postpartum, in that first 6 weeks, it's mostly about diaphragmatic breathing, that deep core connection, making sure that we can
Mhm.
activate the pelvic floor with breath, and then mobility movements to make sure that when you're in that position holding a baby for
Mhm.
20 hours a day, you're not getting super tight, because what's
Yeah.
happening up here in the arms and shoulders is affecting the diaphragm and your rib
Mhm.
cage, which will affect how your core and your pelvic floor is healing. So
Yeah.
it is a completely different, it looks completely different in that first 6 weeks postpartum, but there are definitely
Yeah.
things that I would advise people to start doing. But mainly, if you wanted one thing to take away, it is that
Mhm.
diaphragmatic breath. It's the hands on the rib cage, making sure that when you breathe in, the rib cage is expanding. You're not just blowing out through your belly. And then
Mhm.
as you exhale, you're going for a Kegels lift at the same time as breathing out long and slow until you can't breathe out anymore. And you're just trying to get
Okay.
all the parts of your core reconnected, because that's the basis
Yeah.
of everything, like your
Yeah.
non-exercise posture, your
Mhm.
exercise core, everything. That's where we
Yeah.
start. Mm.
How many breaths of that diaphragmatic breathing would you suggest that women start with?
Um, I mean, you can start this literally the day that you deliver. If
Okay.
you've had a C-section,
Mhm.
that kind of diaphragmatic breathing is great as well, because it calms your central nervous system. But it also provides a little bit of movement to the scar tissue, which we need for active
Mhm.
healing. And if you're teaming that with a pelvic floor lift, that's also going to integrate there. So I just say to people, just try one or two to start off with, see how that
Mhm.
feels. And then I reckon by a week postpartum, you should be able to do um, 2 to 4 in, like, lying on your belly, lying on your back, coming onto kneeling position, coming seated, and then standing, because you want to be able to do that
Yeah.
effectively with different elements of gravity affecting you. So
Yeah.
that we function in multiple positions in life, in our day. So being able to activate your core in those positions is really essential. But I've built up to it over the first couple of weeks.
Yeah, that makes sense. And then would you kinda have them spread those throughout the day, not do 20 breaths in the different positions all at one time? Do you kinda do a little bit here and there throughout your day, or is it better to do them all sequentially?
I would do it throughout the day. I mean, that's
Okay.
much more achievable as well. I think
Yeah.
one of the biggest barriers that my mums have is that they're just like, I just don't have time to spend an hour doing this exercise. And also, there's that mental barrier of, I'm not in my exercise clothing, I haven't got my mat out. And, if you get to the end of the day and you haven't done it, then it's not going to happen. Whereas if you can, my favorite thing is have you read James Clear's book Atomic Habits?
I have not.
It's amazing. It's changed my life.
Okay.
But
Okay. I'll put it
he
on the list.
he talks about ways in which it's effective to start new habits. And a big thing of his is habit stacking. So you don't have to use as much willpower or memory if you stack habits together. An example
Okay.
would be you go to the toilet, then you wipe, then you flush the toilet, then you wash your hands. So you've stacked 4 habits together and you're not
Okay.
even thinking about it. They are just a sequential pattern that
Yeah.
happen every time you go. And so if you can then add one of these breaths to a habit that you're already doing, you're going to do that multiple times throughout
Okay.
the day, and without having to think about it. So I actually do tell people to, after they finish peeing, before they stand up to flush the toilet, sit there because it's probably one of the times when you might be unaccompanied
Yeah.
or have a little
Might.
yeah. But that's when you're going to do one of your nice diaphragmatic breaths. You're going to so not while you're peeing. We're not doing that anymore.
Right.
But after you've finished, you're going to do a nice breath in through the ribs, and then you're going to exhale and add in that little Kegel's lift, and you're going to feel that kind of tightening and contracting around your lower abdominals. And you
Yeah.
just do that once or twice, and then get up and move on with the rest of your sequence.
Yeah.
And it
That
just
makes a lot of sense.
it makes it really achievable. And the same with say for those, breastfeeding, nursing, or holding
Mhm.
mums, baby carrying, every time you
Mhm.
walk through a door frame, to have your arm up in that
Mm.
kind of cactus position, and to
Yep.
just stretch the chest and the shoulder just as you walk through. So as you're walking through, hands on the door frame, feel that stretch, maybe
Mm.
do a diaphragmatic breath while you're there, and then through you go, and then maybe on the other side as you come back the other
Yeah.
direction. But it's that
Oh,
little and often aggregate application of movement in those first few weeks postpartum that's going to make the big difference.
yeah, that makes so much sense. I remember even, the holding the babies is one thing and kind of curling it, but man, when you're breastfeeding and you just stare at your baby the whole time and you're like, your neck's getting
Oh
sore
God,
and
no.
yeah, like, but they're so cute. You got to look at them.
Yeah, I know. It's like baby TV. You can't take your eyes away. Uh,
Right, right.
yeah,
I know. I remember being like, but I don't know. My daughter maybe was like 6 months old or something. And I was like, what did I used to do? Because all I do now is just lay here and watch her.
I know. My kids have just come in to get their breakfast this morning, and I'm looking at them now. They're 14 and nearly 14 and 16, and it's hard to
Yeah,
imagine that we were doing
it
that,
is.
just a few years ago.
Yep. Yeah, my daughter graduated high school last year, so during graduation time, we were pulling out all the pictures and stuff, and I was like, "Man, they just changed so much over the 18 years." Yep.
Yeah.
So, talk to me about once the ladies are a little bit further out, they're ready to kind of get a little bit more active. Do you slowly increase their exercises? Is there still a lot of stretching and stuff involved at that point, or are you changing focus more?
I mean, we change and adapt as it really depends on how someone comes to me in the first place. If someone hasn't been able to move out to work out during their pregnancy, they're going to have much less muscle tone and tension, and
Mhm.
so it's a build up. But I usually work with people for 12 weeks because I think that's the minimum amount of time that we can really make effective change and embed new habits. And I'm very much of the mantra that I am not touching. I mean, I would refer people to a dietitian or a nutritional therapist for that side of things. But I think within the realms of a personal trainer's qualification, we do have some expertise, but we're not experts. And this is
Yeah.
a time when we really need to be making sure that people are getting the adequate amount of protein, the right amount of vitamins, um, and enough protein. Yeah, they need help on that side. So I'm not working on the
Mhm.
diet. I'm not
Okay.
doing bounce bodies. I am not doing, get your body back boot camps. We are making you strong and functional for life because, this body is our only one, and
Mhm.
postpartum is this massive period of change. So
Yeah.
we're incrementally increasing it. So
Mhm.
I think what that looks like is in the first, 2, 3 weeks, we're doing diaphragmatic breathing in different positions, core activation, making sure that we can activate our pelvic floor appropriately and relax it appropriately. And then we're adding in increasing strength. We need to build that strength back up because you're going to need it when you're carrying baby and
Mhm.
moving baby around for hours and hours and hours, and it only get heavier. So yeah, it's an increase in strength, and that's
Okay.
super important for women as well. I mean,
Yeah.
we know all the evidence is coming out. We need strength training, but we need to be cardiovascularly fit, lifting teeny tiny weights, and hoping that that's going to serve us into our latter third of our life is not good enough anymore.
Yeah, absolutely. Yeah, there's so much research coming out now with in the perimenopause, menopause phase of life about how much lifting weights and
Mm.
even doing some heavy lifting a couple
Yeah,
days a
yeah,
week is really imperative. And I love the study that came out that showed that women who work out
mm,
consistently have less of a chance of getting Alzheimer's than women who don't work out consistently.
yeah,
And those that did end up with Alzheimer's got diagnosed 11 years later
yeah,
in life than women who weren't working out and had lesser symptoms.
yeah,
If
yeah.
that's not a kick in the butt to go work out, I don't know what is, because I
I
have watched
know.
so many patients and family members go through dementia and Alzheimer's that it's terrifying.
Yeah.
If all I have to do is work out to help prevent that,
Mm-mm.
sign me up.
I know. I know, and we're getting this really interesting trend. I mean, I don't know whether it's global, but where I'm at the moment, there are a lot of women who are now giving birth to their second and third kids in their, early mid 40s.
Mhm.
And that we're then also crossing over postpartum with perimenopause.
Yep.
And that's a whole other delightful combination of
Right.
symptoms that we need to. So getting people back being strong fast is protective. It's protective for later life. And we get to
Absolutely.
perimenopause and menopause, and we've still got a third of our life left. It's not time to wind down and to just accept fate for what it is. This is time
Right.
to be proactive and make it what we want.
Absolutely. Absolutely. So, in your practice, as women are getting stronger, do
Mhm.
you, what are you kind of helping them use as far as do you do free weights, machines? Do you have a kind of a certain repertoire that you like with your ladies, or do you mix and match?
A mix and match, but my preference, if possible, is to make things as easy as possible. And for most
Okay.
people, easy when they've got kids is using free weights and using equipment that they have at home because, again, it removes another barrier. They don't then have to go to the gym, find the specific machine that does that.
Mm-hmm. Yep.
I can teach them how to confidently use what they've got around their home. And I do ask people to get various dumbbells and
Okay.
Pilates ball and resistance bands. And so we can use what's in the home and make it super easy.
Yeah.
Um, but yeah, I love functional strength. I think
Mm-hmm.
that's um, if your concern is not just about aesthetics, where I think you do need to be a bit more prescriptive about which muscle you're working when and how much. If
Mm-hmm.
you're thinking about functional strength that's going to keep you strong and be able to live life without pain,
Yeah.
then using free weights is so versatile. Free weights
Yeah,
are
I
versatile.
agree. I like free weights a lot too. And just in my own personal working out and in my gym life history. I like it because then you incorporate the balance aspect of
Yeah,
it and your feet get stronger when you're standing there holding things and stuff versus always sitting on the machine and just using the resistance of the machine. So I love that you encourage the free weights. A lot of women are scared of that
yeah.
at first.
Yeah, I mean, I can totally relate. I still, as a trainer for 15 years, I still feel a bit intimidated sometimes walking into the gym environment where everybody seems to know what they're doing and they're all in their routines. But I think if we can just break it down, we break it. There are several movements that we base everything around. Squat, so literally
Hmm.
sitting up and down from a chair. Lunge, which is a form of stepping, so single
Hmm.
leg, one in front of the other or out to the side, well, multiple directions.
Yep.
Push, so anything where you're pushing something away from your
Hmm.
body or your body away from something, pulling up and down,
Yep.
back, up. And then rotation and balance and plank. So if we can build a routine where we just have those six things and you are just doing one element from each, and it can be super simple and boring, boring, yeah,
Yeah.
if you want, or you can make it super inventive and innovative. But as
Mhm.
long as you're getting all of those parts in, the whole body is going to be worked in
Yeah.
an appropriate, healthy way. And when you break it down like that, I give my clients a challenge. I'm just like, right, okay, so if I wasn't here, if I'm sick next week, what would you be doing? And they're like, oh,
Mhm.
I stand up and down I'll sit up and down from the sofa, and I do that, 12 lots of 2 lots of 12 times, and I'd, maybe hold my weights with me, and then I would lunge walk across the room, and I'm like, yeah, yeah, okay, yeah, you got it.
Yeah.
Once you kind of peel back the intimidation layers, it's actually quite simple to put together, but always more fun
Yeah.
to do with friends or with a trainer, I think.
Yes,
Get more
yes, and it's
motivation up.
nice, especially if you're new to working out, to work with a trainer so you can make sure you're doing things correctly because
Mhm.
form makes all the difference.
Yes, absolutely. All the difference. I think if you have the ability to either, to hire a trainer or to work out with a friend who knows what they're doing,
Mhm,
do it, because they've got eyes where you can't see. And if you're not in a place with mirrors, you can't check to, like in the deadlift, you don't want to be arching your back, you don't want to be rounding your shoulders. Having someone to check that for you and give you real-time feedback is really empowering.
yeah. Do you do a lot of compound movements with your women where you're working more than one muscle group at a time, or do you like kind of the isolation?
I think keep isolation. Uh, if someone isn't used to working out, if it's not
Mhm,
their thing, then we start with isometric holds and single movements, because it's
yeah,
simple and it's easy to get to grips with. But I
yeah,
want to move up to compound movements as fast as possible, unless someone has got specific pain or dysfunction. When again we take
mhm,
it down and simplify it. But compound movement is functional. Like we're picking our baby up off the floor and putting it onto our shoulder. That is a
mhm,
massive set of chain reactions going through the
mhm,
body. Or we're closing the car trunk at the same time as
mhm,
holding a weight on our shoulder, our baby on our
yeah,
shoulder, or we're twisting, rotating, putting the car seat into the car.
mhm.
That's heavy. That is heavy, and
It is heavy.
to be able to rotate and push that weight away from the
Mhm,
body without damaging your back, is that's an epic move. So the
yeah,
faster we can get to this real life movement patterns, which are compound movements, the
right.
better.
Yeah,
But there's always
and
a
I
time
think
and place for simplification.
yeah, absolutely. And I'm just thinking, with the busy moms and like you brought up, I don't have time for that. If you're
Mm-mm.
doing the compound movements, you're going to get through your exercises faster because you're working more than one body part at a time versus
Yeah.
doing biceps, triceps, chest, back all
Yeah.
separately. It takes a lot longer.
Yeah, and responding to a need that the mums we were working with had, I've created this little series of Move Well mini workouts where it's literally 10 to 15 minutes. If you want longer, you just repeat it 2 or 3 times, but it's just a quick little blast that's going to give you all of those like 6 movements that you need in
Okay.
15 minutes, and it's amazing. It's really taken off. I'm really excited. It's been
Yeah, that's
like a
awesome.
bit of a passion project to try and make sure that people had the access to it, but it wasn't going to be intimidating and take up more of their day. But
Yeah, I love that. That's fantastic. So you mentioned the diastasis recti.
yes,
I know a lot of women, and like you said, we pretty much anybody who lasts long enough
mhm,
in pregnancy is going to have
yeah,
some to some degree.
yes.
What are some of the best things that we can do, particularly for that?
In pregnancy or postpartum?
I guess postpartum is what I'm thinking of in my head right now because I know a lot of ladies don't even realize that they've had it happen during
Mm.
pregnancy.
So they need to re-coordinate their core. So
Hmm.
they need to that diaphragmatic breathing, that
Okay.
360-degree expansion of the rib cage with an exhale and a pelvic floor lift. If you imagine your core is like a can of soda.
Hmm.
So at the top you've got your diaphragm, at the bottom you've got your pelvic floor, and then the aluminium wraparound tin is your deep core muscles, your transverse
Hmm.
abdominals, and some muscles in your back, and your rectus abdominis muscles. There's always pressure in this. When you cough, when you sneeze, when you laugh, that's obvious, like pressure being
Yeah.
created. And if you've got a diastasis recti or pelvic floor dysfunction, you might leak a bit of urine, or you might see your stomach coning, so it looks like a tent
Hmm.
leak. And if you when you have diastasis, obviously you have that kind of weakening at the front of the abdominal wall. So
Hmm.
we don't have integrity there. So we just need to get the muscles coordinating. The diaphragmatic breathing, the exhale with the pelvic floor lift,
Mhm.
team together is the foundation of everything. That's I
Okay.
mean, if you're trying to do any other kind of abdominal work and you haven't mastered how to get those deep core muscles working, then they will be ineffective or
Okay.
not very effective. So
Yeah.
we need to do that. We need to see where your diastasis is. We need to see how deep it is because that will determine whether we are trying to engage your oblique muscles, which are your side abs, or whether we're
Mhm.
just trying to focus on your deep transverse abdominal muscles. And there are different exercises for each, but the key thing is the breath. And to be doing that from as early as you can in as multiple positions as you can. And
Yeah.
then
I love that.
yeah, because breath is simple. We breathe every
Mhm.
day. And
Yeah.
also, there are so many other benefits. Your vagus nerve runs down through the diaphragm. So, when you are moving the diaphragm, it's kind of massaging and stimulating that, which switches on your parasympathetic nervous system, which is that
Mhm.
lovely kind of calming sensation, which I don't know any mum who doesn't need a little bit more in their life. So,
Yes.
just a little
Yeah.
bit of breathing can really,
Yeah,
really, really
absolutely.
help.
Yeah, and I love that because there's no equipment needed. It's really just you and when you can fit it in and to your own strength and all of that. I think that's great. And it's so easy for women to do. And I think that, especially as we're going through all these changes, we want to have control over something.
Yeah.
And that breath work gives us some control.
Mm. Yeah, I mean, it's the very first step. And then we can add in some Pilates based exercises like the dead bug, where you're lying on your back and you're sliding opposite arm and leg away from your body,
Okay.
or the dead bug, or the bird dog, when you're on your hands and your knees and you're trying to
Mm,
extend arms and legs away from your body. Um, yeah, we start with the breath
yeah.
and then we move from there.
Okay. I like that. That's great. So, I think the other thing that comes to mind with postpartum is women getting back their um self-esteem, their love for their body, their desire to have sex again because they have had all these changes and stuff. Do you see a lot of that with your ladies in this postpartum frame? Are they really in their head about certain things?
Yes, and I think it's so impossible not to be. I mean, you know, I don't think the village prepares us for birth and for parenthood, but there is so much that's still not really spoken about. There's a brilliant book that I suggest all my mums read called Matrescence by Lucy Jones.
Okay.
And it talks about this season of life after you've given birth and what's happening in your body, the science of the hormones, what's happening, and then societal expectations and pressure. And I think there's a massive disconnect. And with that comes an unrealistic expectation of what your body should be doing, how it should be responding, what it should be feeling. And we know that, not this isn't limited to mums that do breastfeed and are nursing, but when you're producing prolactin, which is the hormone necessary for milk production,
Mhm.
it has a massive impact on the hormones that um, uh, allow your vaginal moisture to be there and your
Mm,
lubrication. So your labia and your genitals look and feel different, which has an
mhm.
enormous impact on your sexual desire and what feels normal for you. And so I think with my mums, I have the conversation in pregnancy with them, and then we talk about it when we first meet postpartum. And my top tips are, especially when it comes to sex, are lube, get a really good lubrication. Obviously remember, if you are trying to get back in the bedroom, don't use an oil-based one unless if you're using condoms. So make sure it's
Mm.
water-based. Please make
Yes.
sure it's water-based.
Yes.
But lubrication is, I mean, sex with lube is so much more fun anyway. So we need that in our lives.
Yes.
But also, I really invite mums to go and have a solo exploration, and if that leads to a solo session, do that first because even if you've had a C-section, things are going to look and feel different. You're going to
Yep.
have a different relationship with your body and with your sexuality. And having a solo session is going to mean that you are not responsible for someone else's pleasure while you're trying to figure out if you even have yours anymore.
Yeah.
Um,
Love that.
so
Yeah.
Yeah, so
It's so
that
important. I'm a huge, huge proponent of self-care, self-alone time, masturbation, whatever you want to call it.
yeah.
But it's so important. And what worked for you before you had baby may not work for you after baby. So you have to
Absolutely,
explore.
absolutely. Especially yeah, you really
Yeah.
do, you really do.
Yeah.
And, another tool that I love to recommend to people is, a website called OMGYES. I don't know if you've come across it, but,
Yes.
amazing. I've
Great
gifted this
resource.
to my mum, to my sisters, to my aunts.
Yeah.
Like it is a set of tutorials that are
Mhm.
based around different types of sexual pleasure, clitoral stimulation, penetrative stimulation, and
Mhm.
then I think the use of toys. They've got a few different
Mhm.
modules, and it's very explanatory um, tutorials. Not something to
Yeah.
watch with anyone you don't want to see it in the room because it is quite explicit. But I've had
Yeah.
people tell me that they've never had an orgasm before, and then they
Mhm.
use these tutorials and they have. And I think if you're needing a little bit of a boost of self confidence, or you're
Mhm.
rediscovering what feels good for you and what doesn't, then the use of something, a third party like this website, I think is
Mhm.
really, really helpful because you can also watch it with your partner. Um, and it just kind of takes that pressure off because
Yeah.
I can promise you they're going to be stressing out about the first time you guys are intimate as well,
Yeah.
because they're going to be concerned that about how
Yeah,
you're feeling
absolutely.
and your needs,
Right.
and ultimately everyone wants to feel good.
Yes, absolutely. And then there are also women who, all right, you went to the OBGYN, they checked you off at 6 weeks and said you can start having sex, but mentally, you're terrified. You just pushed this 7 pound baby out down there. How are you going to feel good enough? And so I think that's something that's really important for the postpartum ladies as well is just because your OB says you are medically allowed to have sex does
Yeah.
not mean you have to have penetrative sex. You
Yes.
can have oral sex, you can use fingers, you can do other things
Yes.
to work your way back up
Yeah.
to taking your partner.
Yeah. Absolutely. And I think I think the first thing to kind of work on is just seeing how your bits feel,
Mhm.
and then to try and aim for a clitoral orgasm because that
Yeah.
is it's pleasurable, but it's not penetrative, and
Mhm.
you can do that with yourself and with a partner. Super. Well, not for everybody easily, but it's the really
Yeah.
good place to start. And also that process of having that pelvic floor contraction, strong pelvic
Mhm.
floor contraction, and knowing that you're okay after it is really confidence boosting for so many people.
Yeah, absolutely. Absolutely. Yeah, and you wanna make sure you're not peeing when you have sex or, like, there's all these things that women go through in their heads that are gonna happen after you had these kids. Your uterus is just gonna fall out during sex, like, there's all these different things, and so I love taking your time, doing the solo, in like you said, inviting your partner to be a part of watching some of these videos, maybe taking penetration off the table for a while and just enjoying the other parts while you get back into it with each other. I think there's so much benefit in that.
Yeah, yeah,
Yeah.
100%. Yeah,
Yeah.
I think, and also to understand that there is not a normal timeline. I think that it ranges from anything from 4 weeks, 3, 4 weeks postpartum, to I think 19 months is
Yeah.
after 19 months it's then seen to be well, maybe let's investigate this a little bit. But
Yeah.
I think for myself, I think it was about 10 months postpartum. I was not ready. Just
Yeah.
I didn't feel like a sexual being. I didn't feel like I was ready. I was a human cow.
Mhm.
And you know,
Right.
my boobs were for milk. And
Right.
I couldn't get my head around the fact that I could be anything else. But
Yeah.
I also think that if someone's experienced any form of birth trauma, then there needs to be some counselling. There needs to be some therapy that happens because sex is a very intimate, very vulnerable state.
Yeah.
And if you're 6 months plus down the line and you haven't felt like having sex yet, don't worry. I mean, you know, think about why that might be, but
Mhm.
also there is a range that is normal. So don't feel pressured. You don't need to be like 6 months. I have to have had sex by 6 months. You don't. You
Right.
just need to
Right.
understand how you're going to get back there.
Yeah.
and have got them
I mean, I
to.
think it goes with, anything that we say about, pregnancy and postpartum. The baby didn't grow overnight. The baby took 9 months, 10 months almost to grow, and your body was changing that entire time.
Yeah,
You're not going to flip a switch and be back to even your same thoughts or anything
yeah,
that you were right away. It takes
mm,
time. It takes time to heal. I had 2 C-sections and I still had pain with vaginal
yeah,
penetration 6,
yeah,
8 weeks afterwards.
yeah,
And so it doesn't matter which way you have your kid. And it obviously, if you're having tearing and episiotomies and things like that, it's going to take you longer to heal.
mhm,
But it doesn't matter how you have your kid. You need time to heal and you deserve the respect to come back to your sexuality and your sexual
yeah,
function on your time frame.
absolutely. I think also I'm glad you brought up how having a C-section still affected your sexual health, because
Mhm,
I'm finding that vaginal deliveries, but the trauma to the perineum and
mhm,
episiotomies and tearing, yes, that is a very real thing. But I'm finding most of my women that are presenting with pelvic floor dysfunction have had C-sections, and it is because they're carrying too much tone in the pelvic floor, because they've
mhm.
been, they never, the perineum was never stretched, but also just the way that they carried, and then the healing process postpartum, they've
Mhm.
been lifted and clenched and tight,
Yeah.
and gripping their butt cheeks, which then
Mhm.
carries more tension to the pelvic floor. So a lot of what I'm doing with my postpartum mums is trying to just lengthen
Mm.
their glute muscles, and with that, and lengthen their pelvic floor, because yeah, that is a problem.
Yeah, it is. Absolutely. And you need to be stretched and relaxed down there to enjoy sexual activity.
Yeah.
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 If you're already tense, it's just not going to go well.
Yeah. No, it's not. It's not at all.
Yeah. Yeah,
Yeah.
absolutely. Oh, what a fun conversation. I love that we've kind of gotten into this, pregnancy time frame. Because I am perimenopause, I end up talking about that a lot. So I
Yeah.
love that we're talking to my other ladies who aren't at that phase yet or who are but are still having kids.
Yeah.
It just is such a great conversation and I just appreciate you being here so much and providing all of your knowledge for our listeners.
No worries. I think we have to talk about it. And with that, we have to also look to our healthcare providers to get out there and, get more data, because without data, it's very difficult to have any evidence-based practices.
I agree.
And so we just, at the moment we rely on the village, and talking about it, which is very powerful. But I'm also pushing for change.
Yeah,
I,
for
I
sure.
want more data.
Yes, I love science.
Mm-mm.
I love numbers. I'm a big nerd.
Me too.
Yes. But no, it really does. I mean, in your practice and in mine, it's evidence-based. That's what we go off of. That's what makes us better at our jobs is doing this research and knowing why things are working well and, exactly what is working well. So, yeah,
Yeah.
absolutely. We
Yeah.
need more research.
Yeah. I agree. I agree.
Yes.
I'm with you.
Wonderful. Well, thank you again, Anna, for being on here. I really appreciate your knowledge. And for everybody else, we'll see you next time on Between the Sheets.
Thank you.
Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday. Because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. That's all one word, podcastbetweenthesheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can like, follow, and share this podcast so they can see it too. See you next time for more sexual health topics between the sheets.